Welcome, everyone. My name is Andrew Phillips. I'm the business manager at Phillips Accountancy Corporation. Many of you know me, some of you do not. And I just want to thank all of you for joining us, whether you're joining us from home or your office or not on the road. But thank you very much for watching this video. I think you're going to find this information quite informative. With us today, we have a couple of folks from ADP. We have James Stansbury. He's a risk and safety consultant with ADP. We also have Carissa Cood. She is a district manager, and Josh Arkin, also a district manager. And today they're going to talk to us, about a number of things, but mostly related to risk and safety. So I'm not very good at introductions, as anyone who has ever watched these videos has seen. So James, I'm just going to go ahead and let you take it away.
Okay, Jim Stansbury. I'm a risk consultant with ADP. I've been with ADP now for, I think, 12 years, coming up on 12 years in December. I've been in the field since 1986, and the fact that I'm only 35 years old makes that really impressive. I help clients with any work comp issues and help them identify hazards in the workplace, set up safety programs and safety plans for the clients. And I love my job.
Well, perfect. So let's get right into this. What has been the biggest challenge that you've seen with getting back to work regarding COVID?
It's been very tough for employers. You know, back in March, the American Dental Association closed or advised their participants to close their offices to only urgent and emergency procedures during COVID-19. So, but as we've come to understand the disease more and we're able to deal with it better, more and more offices are reopening. The real challenge has been how to reopen those offices safely. Whether an employer has been open throughout the pandemic or just getting back to work, navigating these ever-changing employment laws is a serious issue for them. Employers have to worry about which employees should return to work, who's nervous about returning to work, who should stay at home, do we stagger shifts, how many employees can I allow in the office, what type of personal protective equipment do I have to provide, cleaning their desks, who cleans the office, who cleans the microwave, how do I create that infectious disease plan that will allow me to bring the employees back safely. Employment-related legal issues and OSHA complaints are on the rise. So employers really need to create a plan that addresses employee concerns about feeling safe in the workplace. Keeping up with the ever-changing compliance issues is definitely the biggest challenge employers face today.
Now, speaking of keeping safe in the workplace, one of the things that I know when I go to a dentist, they even before COVID, they would wear a mask when they were cleaning. What do you recommend that they take additional PPE steps, or do you recommend that people in the front office take additional PPE steps?
I definitely recommend they take additional steps. I was recently at a dental office doing some work there. And I walk in and I'm watching their procedures. And for instance, they did a great job. They gave out free pens to everybody, so no one had to use the same pen. In fact, I'm using their pen today. You signed in and completed your medical forms in one location at one desk. And my issue there was no one was cleaning the desk in between uses. They gave you a free pen, but nobody cleaned the desks. The waiting room, they had two chairs, both with armrests on it, and patients were allowed to sit in those two chairs only. But the chairs weren't being disinfected in between. So their protocols needed work as far as making sure that both their employees and their customers, their patients, were protected. Once I got into the back, there were issues with, they wore perfect PPE as far as they were wearing face shields, they were wearing masks, but the issue was the face shields really came out too far away from the face, and when they put you back in the chair, you were looking right up into the face shield, and you actually were looking into the space between the shield and the dentist's mask. So we looked at that and we suggested some different types of face shields that they might want to use. There's still a shortage of proper PPE out there, and I think that we're still navigating and dealing with that issue. But as I think the main point is, take a look at your PPE, take a look at your protocols of how you bring patients in and through the office, and maybe rethink that, and maybe have somebody else, another eye, take a look at the procedures.
That makes perfect sense. And you know what, I like that you say to have somebody else, have a second set of eyes look at the procedures. That's not something that I had thought of, but obviously it makes sense because sometimes you can miss something, and so having somebody else take a look at what you're doing makes a lot of sense. What are some of the new OSHA requirements in the medical or dental fields?
I wouldn't say they're necessarily new. I think that OSHA has always recognized the key role of the healthcare provider and the role they play in protecting not only their own employees but the general public. So they've always required the employer to have a plan to combat the swine flu, avian flu, the seasonal flu. But now COVID has really pushed all of this to the forefront. So OSHA, while they've always encouraged employers to have a pandemic response plan, it's now definitely required and should be on the top of your list. OSHA will use the general duty clause to enforce the standard. And the general duty clause, if you're not familiar with it, is probably the most cited clause used by OSHA when they cite an employer. And all it really says is that the employer has the responsibility to provide their employees with a workplace free of recognized hazards likely to cause death or serious injuries. So the first thing they're going to want is a plan. They're going to want you to do that hazard assessment and really take a look at your facility and determine the risks and the hazards. And that's why, as we talked about, having a second eye or have someone else come in and do a review is really important, because they could catch what you might have missed or maybe recommendations to make it a little better or safer in the workplace.
Now, Jim, in addition to having this pandemic plan in place, in addition to having another person take a look at this plan and see how you're handling things, what do you feel would be the best way to protect the company against COVID?
What is the best way? I think employers really need to rethink how they're doing things, reimagine it, and be ready to repeat the process over and over again. I mentioned the infectious disease preparedness and response plan. I think that is the number one way to help identify hazards and put in place protocols to protect your employees. We have to look at things like individual state occupancy limits, which employees need to come back, rotation schedules, if you're able to have some employees work from home, one-way traffic even through the office. In this case, the practice I went to the other day, they only allowed one person in the hallway at a time. So everyone else was stopped until one person cleared the hallway, then someone else could enter. It was a great protocol. They only had one narrow hallway, so they did a great job. You have to be ready and constantly reviewing compliance with federal, state, and local regulations. That's why you really need to connect with your advisors and really take a look at where you stand now and have them educate you as new compliance and regulations come out from both OSHA and federal and state organizations. Designate a safety person who performs daily hazard assessments and goes through the office and really takes a look at, okay, are we really following our plan? Make sure you provide proper masks and gloves that, especially masks that actually fit are appropriate for the work that you're doing. Add signage. You have to have that FSCRA poster up. Add some hand washing signage. Add some hygiene posters to remind employees to take care of themselves. Then you really have to have a plan for screening and tracking employees. So whether it's an app or whether you do it through a text message each day or an email message, you don't want employees coming in and being screened if possible. You want to have them screen themselves at home and certify that they're able to come in if they haven't been in contact or close contact with anyone with COVID. Make sure your cleaning and disinfection protocols are up to date. I mentioned the chair and the counter. These are things that they just didn't think about. Who's going to clean that coffee pot if we share a coffee pot? Who's going to clean the lunchroom, the break room? How do we do it? How many people do we allow in there? And then really have a protocol for if you do have a suspected or a confirmed case of COVID-19, have a protocol in place to deal with that. Know what you're going to do right away. Keep up with those regulations of what you have to do as far as from a quarantine perspective, as far as testing, and as far as reporting to the state. In some states, you have to actually report the positive case to the Department of Health. I think it's a lot, but if you create that infectious disease preparedness and response plan, I think it will provide you a clear reference or guidance going forward, and you won't have to do this last minute scramble for answers.
Perfect. Well, I think based on what you said so far, I've learned that employers definitely cannot wait for this pandemic, this disease to strike their workplace. They need a plan before it happens, and they need to be ready to implement their infectious disease preparedness and response plan. In addition to that response plan, is there any other documentation measures that are what you would consider non-negotiable?
Yeah, having the IDP is super important. A lot of states even require you now to submit your plan, or at least confirm that you have a plan in place. But then you also have to worry about, you should be worried about the OSHA 300 reporting logs, your 301 logs. OSHA is going to place greater emphasis on these logs because OSHA is of the opinion that COVID is a work-related illness. So you have to make sure that you're doing your tracking properly and confirming where your employee may have come in contact with the disease, if anyone else in the office had contact with that, and make sure you're recording these injuries appropriately, and if necessary, creating a worker comp case for that employee.
And now, what do you think are some of the biggest areas that OSHA tends to focus on specific to a dental practice?
There's no specific OSHA. I can't go to OSHA and look up a standard for dentistry, but there are several OSHA standards that apply and that dental practices really need to focus on. The first and normally the most important, other than the infectious disease plan now, which is at the forefront, is the bloodborne pathogen standard. An office needs to really identify and create a written exposure control plan. That plan has to be updated annually. It has to review the use of universal precautions, safe needle use, engineered needles. The hepatitis B vaccine has to be provided to exposed employees at no cost. Medical follow-up in the event of an exposure incident. You have to watch your labels and your color coding for sharps, disposal boxes. And then, of course, you have to train your employees on bloodborne pathogens. Normally universal precautions don't apply to saliva. However, during dental procedures, blood can be mixed with saliva, and therefore bloodborne pathogen standard would apply. So it's important to make sure you have that in place, that bloodborne pathogen standard in place. After that, I'd say a hazard communication standard, the employee right to know. They need to know what chemicals they're exposed to and what they need to do to protect themselves from it. Ionizing radiation applies to any facility with X-ray equipment. The employer has to know the types of radiation and restrict employee exposure, use personal radiation monitors, label all rooms and equipment, and then once again, provide that training to all employees on how to operate safely around the equipment. OSHA is very big on dental practices having an emergency exit procedure. So you have to have a written plan and provide evacuation drills so that your employees have a safe and accessible exit route from the building. And then the electrical standards. So there's electrical equipment in the practice in the building. You have to be able to follow proper lockout tagout procedures, and your employees need to know if there's any special wiring or equipment that could pose a hazard to them. So that's the general topics you need to cover.
Fantastic. And you know, in addition to that, I've heard about an injury illness prevention program. What is that, and is that something that you would recommend?
Highly recommend it. The Illness and Injury Prevention Program, or IIPP, is required in California. It's required in several other states. So if you don't have it and an employee is injured and you don't have an actual IIPP in place, it could be an issue from a legal standpoint. In California, Cal-OSHA requires the injury illness prevention program to be in a written form. It should cover the topics and the hazards that you find or your employees could be exposed to in your workplace. So an IAP for a dental or medical practice, at a minimum, should have written policies discussing bloodborne pathogens, personal protective equipment, hazardous communications, ionizing radiation, emergency evacuation, electrical safety, and I would add things like back safety, an ergonomics policy. I can't tell you how many dentists I've seen with suffer back injuries and neck injuries. There are other policies they might be required to have, so you have to check your state. For instance, California requires healthcare providers to have an aerosol transmissible disease control and prevention plan. Dentists are usually or often exempt from this requirement if they follow certain conditions, such as dental procedures are not performed on patients screened and then identified as ATD cases or suspected ATD cases. The office follows Dental Board of California's infection control requirements and CDC recommendations. The dental staff is trained on the ATD screening procedures in accordance with the IIPP that they create. And even if you're not required to have this type of a program, an ATD is certainly good practice to follow and have in place. Your IIPP really should focus on your management and leadership, who's in charge of the program, getting workers to participate in the program, be that on safety committee meetings or regular meetings, or having them help write the program. Having someone identified as your hazard identification person who does safety audits, someone who is going to be the trainer for the office and help the employees be trained on all the policies you put in place. And then you have to be constantly evaluating and improving that program. So if you find that there's an area that you missed, you want to make sure you go back and put that into your written program and update it so it's effective for your office. But by and far, the most effective plans are those where the employees are involved in the process of creating, reviewing, and updating the plan. So that's so important to have that involvement.
Speaking of employee involvement, would you recommend having a regular, safety meeting, whether it's quarterly or annually, for all the members of the practice?
I definitely recommend a safety committee meeting because it helps make this process so much easier. You can assign different members different topics or areas that they have to cover. So one person might be in charge of the front reception area and how we intake patients safely. Another person might be in charge of, once the patient hits the back rooms, what do we do to make sure they stay safe? Another might be on just performing regular hazard assessments and updating the policies. So it's very important to have the the safety committee in place. Divide and conquer. It's a great way to get everything together and make sure that you're in compliance. You could even have one person who is in charge of making sure, even a situation like now, making sure that you're up to date on your COVID regulations, your state and federal regulations. OSHA Oregon, I think, has one of the best examples of or descriptions of a safety committee. And they say that the purpose of a safety committee is to bring workers and management together in a non-adversarial, cooperative effort to promote safety and health in each workplace. A safety committee assists the employer and makes recommendations for change. I think it's a perfect description of what it should be. Some states actually require you to have a safety committee and hold it at a minimum quarterly meetings. Some states will come in and review your records of safety committee meetings. So it's a great tool to use to really promote safety and get your program up and running in your workplace.
I know there's a lot, but what do you think is the biggest hazard in a medical or dental practice? Ideally what's the biggest thing, but also what are some of the hazards in general that people are facing?
Over the years, right now COVID, obviously. But over the years, bloodborne pathogens, needle sticks, sharps, aerosols has been a major concern. And that's where I've seen the majority of injuries and illnesses come from the dental industry. Besides bloodborne pathogens, chemical exposure, you have ethylene oxide perhaps, or xylene. What other chemicals can be in there? Glutaraldehyde. So your employees really have to know what chemicals they're dealing with and how to properly protect themselves from these chemicals. Even something as simple as bleach, we have to know how to protect ourselves from it. Physical hazards. I mentioned that back issues, neck issues for people in this industry. Surprisingly, slip and fall hazards create a large number of injuries in the dental world. And then, of course, eye injuries, certainly a big issue. So eye protection is key in a dental practice. Further down the list, I'd have to go with ionizing and non-ionizing radiation. I haven't had a lot of issues with that, but make sure your employees are wearing the proper protection. Make sure that the neck and chest protection meet up properly so there's no gaps in there. And then, of course, anesthesia gases, nitrogen, nitrous oxide. Then further down the list would be violence and stress. I've seen a lot of stress cases in dental offices. So you have to watch for that. You have to protect for that. But you really need to have policies, written policies in place to address each of these hazards.
Definitely. So going back to COVID a little bit, what if, or not even just COVID, but I guess in general, what if one of my employees is refusing, I own a dental practice, let's say, and one of my employees is refusing to wear a mask or any PPE due to a pre-existing condition? What should be my response?
Well, we want to be empathetic. This is a scary time for everybody. So you want to make sure that you approach the employee with empathy and understanding, and really try to sit them down and talk to them about what their condition is and why it would require them to not wear a mask. And find some way around it. Find some other mask that might be more appropriate or might make them more comfortable. You're required to make a reasonable accommodation. During a pandemic, employers can require the use of PPE, but we still have to make those accommodations and take into account individual employees' disabilities or whatever other concern that they might have. Some employees just can't wear a mask because they overheat in it. So what do we have to do about that? In some cases, I've seen clients go out and get PAPRs, powered air purifying respirators, and these respirators actually blow nice fresh air across the wearer's face. They're expensive, but the client went out and made the accommodation, the employee's happy and protected. So you got to remember, under all of this, it's your responsibility as an employer to protect that employee. So it's very important that you take into account these accommodations and try to find a way to protect them as best you can.
I agree. Let's say that the worst happens and one of my employees ends up getting diagnosed with COVID. What should I do?
Well, it's more and more frequent. I get several calls a day, probably now, from clients that need help with tracking and have quarantine questions. We're now over 10 million confirmed cases, I think. That number is 10.2 now. Some experts estimate that there could be as many 10 times more people infected than that number, the 10 million number. There's over 239,000 people have died from the disease. That's why I can't stress enough, and I keep going back to it, is to have a plan in place to deal with this. Have your infectious disease preparedness and response plan in place. It could mean the difference between staying open and having to close your facility. The CDC has issued recommendations on what to do in this case. Employees who appear to have symptoms upon arrival to work or become sick during the day should immediately be separated from other employees, customers, and visitors and sent home. Have a procedure in place for the safe transport of the employee who becomes sick. He may be needed to be transported just to his house or maybe to a healthcare provider, depending on how sick he or she is. An employee that tests positive for COVID-19 should be directed to self-quarantine, away from work, and follow the directions from their healthcare provider. The employer has to quickly identify the areas that the employee worked, block it off until it can be cleaned. And if possible, I know this is normally not the case, but if possible, they should wait 24 hours before they clean the area to give the virus time to die on its own, which will minimize the potential for anyone going in to clean the location from becoming infected themselves. And then, of course, you need to clean that area following CDC cleaning and disinfection recommendations. The company, at the same time, has to determine if any other coworkers had close contact with the confirmed positive employee in the prior 14 days and direct those individuals to call their healthcare provider and self-quarantine based on the healthcare provider's directions. The CDC recently changed the definition of close contact. I'm sure you've heard of this, where it was 6 feet for 15 minutes, prolonged period of 15 minutes. It's now within 6 feet and a cumulative time of 15 minutes. So if John goes back and talks to Mary, and Mary turns out to be infected, if he goes back for 2 minutes one point during the day, 5 minutes the next, if it adds up to 15 minutes during that day, he will need to quarantine. So you have to have those employees self-isolate at home for 14 days. Also, you got to check with your states, as I mentioned earlier, that you might have to report this to contact tracers in the state or the Department of Health. So make sure you reach out and for local guidance also, and then reach out to any of your advisors as far as what else you need to do and from a tracking standpoint.
Perfect.
That's
so
today. Tomorrow, this could change.
Exactly, right? It's almost changing. At one point in March and April, it felt like it was changing every week. I'm glad that that may have calmed down on that front. We've talked about the infectious disease preparedness and response plan. We've talked about the hazards in a dental office, and not the least of which is COVID. How can ADP help us rethink, reimagine, and repeat?
Josh, Carissa, you want to jump in here?
Yeah, I could jump in. I could take this. So, ADP is, we are the leading authority on human capital management for the United States and for the world. We pay 1 in 6 Americans. So ADP has developed a suite of services from everything from technology to full-blown outsourcing that we can customize for various clients, whether it's, like I was saying earlier, whether it's just basic payroll technology all the way up to risk and safety consulting, what Jim was talking about. So what we do is, with our clients and our prospects that we're working with, it's really simple. It's simple conversations. Where are they at now? Where are their concerns? What things can we help them put in place to help protect their organization, get more out of their employees, and reduce liability? And it's that practice of finding out which is the best avenue for them, so we can customize a solution to fit the culture of their business. And that's what ADP will do for them.
Perfect. Well, Josh, thank you for that answer. Jim, thank you for your time. And Chris, I'm sorry that we were talking so much that we didn't give you a chance to chime in. But thank you all, the three of you, for your time today. I think this has been immensely helpful, very educational, certainly, and I think it'll be a great value to our clients. And I want to thank everyone who's been watching this. This has been a production of Phillips Accountancy Corporation. And if you have any questions, just visit us online. The website will be listed below. And again, thank you so much and have a wonderful day.